This video will present the NIFT technique for LASIK enhancement. NIFT, or NIFT, stands for Non-Ingrowth Flap Technique. One of the challenges in LASIK enhancements is that the rate of epithelial ingrowth under the flap edge during the healing process can approach 5, 10, or even 15% incidence. The small levels of ingrowth are not dangerous to vision, but larger levels of epithelial ingrowth, perhaps ingrowth of 1, 2, or 3 millimeters into the flap, can distort vision and also lead to flap necrosis and decrease in vision. So in the NIFT technique, we try to give the flap a head start in its healing ahead of the cells at the edge of the flap that have a tendency to migrate under the flap edge. And so in this technique, what you see the surgeon doing is removing the epithelial cells on the rim of the cornea outside of the flap edge. Perhaps 1 or more than 1 millimeter of cells is removed using a blunt corneal spatula. We carry this debridement from edge to edge around the rim of the flap, or around the edge of the flap, and then clean up the surface using a wet sponge and moisten the cornea as it's taken perhaps 30 or 40 seconds to complete this part of the treatment. Once the flap is lifted and out of the way, the excimer laser applies the treatment, and in this case you can see an obvious hyperopic enhancement, and you can also witness the laser ablating parts of the edge of the flap, which provides or creates a ramp for the cells to slip down into the interface. And so by proceeding with this NIFT technique, what we're doing is giving the flap a head start in its healing. And then perhaps in a day, when the cells have reached and migrated towards the edge of the flap, the cells that have been debrided, as those then migrate towards the flap, hopefully the flap will have sealed into place and healing will have been given a head start so that the cells will not migrate under the flap edge. A light pipe is used to witness any type of debris or cell debris or contamination that might be under the flap, and once that's been clean and observed to be clean, a Johnson applanator will be brought into the field to further squeegee out any fluid, and a contact placed on the eye. The contact will be left there for several days and then removed. With this technique, the ingrowth rate has been less than 1%.